The sliding glass doors of St. Jude's intensive care unit didn't just open. They were violently shoved apart. 6 United States Marines in full-dress blues marched into the sterile, beeping ward, their heavy boots shattering the midnight silence. Doctors froze mid-sentence. Security guards backed away, intimidated by the sheer gravity of their sudden presence. They bypassed the screaming trauma surgeons and the panicked hospital administrators. Instead, they stopped dead in front of the quietest, most overlooked night shift nurse on the floor. The commander, a towering captain, snapped a rigid salute. "Staff Sergeant, ma'am," he barked, his voice echoing off the linoleum. And in that terrifying electric moment, every arrogant doctor who had ever belittled her realized they had made a catastrophic mistake. At St. Jude Medical Center in Chicago, the night shift was where ambition went to die. It was a chaotic, fluorescent-lit purgatory, filled with the incessant chiming of cardiac monitors, the hiss of mechanical ventilators, and the heavy scent of bleach masking the metallic tang of blood. In this high-stakes environment, egos clashed as frequently as the crash carts were deployed, and at the absolute bottom of the hospital's unspoken hierarchy was Nurse Emily Stanton. Emily was 34, though the deep, exhausted lines framing her pale blue eyes made her look older. She wore her dark hair pulled back in a severe, no-nonsense bun, her faded blue scrubs hanging loosely on her wiry frame. She never joined the other nurses in the break room for gossip. She didn't flirt with the surgical residents, nor did she complain when she was assigned the heaviest, most grueling patient loads. Emily was a ghost, a silent, hyper-efficient machine who moved from bed to bed, titrating propofol drips, emptying catheter bags, and meticulously recording vitals without uttering a single unnecessary word. Her silence, however, was frequently misinterpreted as subservience, a trait heavily exploited by Dr. Gregory Harrison. Dr. Harrison was the night shift attending physician, a man whose medical degree seemed to serve primarily as an accessory to his towering narcissism. He was impeccably groomed, wore a designer stethoscope slung casually around his neck, and treated the nursing staff like indentured servants. He had a particular disdain for Emily. Her lack of reaction to his bullying infuriated him. He wanted tears, apologies, or at least a fearful stammer. Instead, he got a blank, unyielding stare. "Stanton!" Harrison's voice snapped across the nurses' station at 2:15 a.m. on a grueling Tuesday. "Did you even bother to look at Bedfor's updated labs? Or are we just guessing his potassium levels today?" Emily paused her typing, slowly turning her head to look at the doctor. "Mr. Gallagher's potassium was 3.2 at midnight, doctor. I replaced it with 40 milliequivalents of IV potassium chloride, as per the standard protocol. His current rhythm is stable, and the follow-up draw is scheduled for 0300. Harrison's jaw tightened. He hated being corrected, especially when he was wrong. "I didn't ask for a lecture, Stanton. I asked if you looked at the labs. Next time, wait for my explicit order. You're a nurse, not a diagnostician. Try to remember your place." "Yes, Dr. Harrison," Emily replied, her voice entirely devoid of inflection. She turned back to her computer, her posture perfectly straight. Nurse Chloe Davies, a 22-year-old recent graduate who practically lived in a state of perpetual panic, slid her chair closer to Emily. Chloe's hands were shaking as she clutched a clipboard. "Emily, how do you do it?" Chloe whispered, casting a terrified glance at Harrison's retreating back. "He talks to you like you're dirt on his shoe. If he spoke to me like that, I'd be crying in the supply closet." "Tears don't keep patients breathing, Chloe," Emily said softly, her eyes scanning a complex array of fluctuating numbers on the central monitor. "Let him talk. Words are just wind." "But he's such a jerk," Chloe protested softly. "You practically ran the entire code on bed 6 last night before he even sauntered into the room, and then he wrote you up for pushing the epinephrine 5 seconds before he gave the verbal command." Emily finally looked at the younger nurse. For a brief second, the stoic mask slipped, revealing a glimpse of something ancient, hardened, and incredibly dangerous beneath her calm exterior. In life-or-death situations, you act on training, not permission, Emily said, her voice dropping an octave. I saw a dying man. I did what was required. His write-up means nothing to me. Before Chloe could process the intensity of Emily's statement, the shrill, terrifying alarm of the Code Blue system blared through the ward. The flashing red light above Room 12 began to spin. Room 12, severe sepsis, multi-organ failure. Emily was moving before the first cycle of the alarm finished. She didn't run. Running induced panic, but her stride was impossibly fast and purposeful. She hit the door of Room 12, assessing the chaos in a fraction of a second. The patient, an elderly man, was in ventricular fibrillation. The bedside nurse was frozen, staring wide-eyed at the jagged lines on the monitor. "Step aside," Emily commanded, her voice cutting through the panic like a scalpel. She slammed the backboard under the patient, locked her hands together, and began chest compressions with brutal, mechanical precision. "Chloe, grab the crash cart. Charge the paddles to 200 joules. Draw up 1 milligram of EPI and 300 of amiodarone." Dr. Harrison burst into the room 30 seconds later, his coat flying, his eyes darting frantically. "What happened? What's his rhythm?" "V-fib," Emily stated, not breaking the rhythm of her compressions. "Paddles are charged, doctor. Say the word." Harrison grabbed the paddles, his hands visibly trembling. He hesitated, looking at the monitor, second-guessing himself. The tension in the room spiked. Seconds were bleeding away. Brain tissue was dying. "Clear!" Harrison finally yelled, shocking the patient. The elderly man's body arched off the bed, but the monitor immediately resumed its chaotic, deadly scribble. "Resume compressions," Harrison stammered, stepping back, looking lost. Push the EPI." Emily was already back on the chest. She had signaled Chloe to push the epinephrine 3 seconds prior. "Pushed!" Chloe squeaked. For 10 agonizing minutes they fought death in Room 12. Emily's compressions never wavered. Her stamina was terrifying. Most nurses needed to swap out after 2 minutes, but Emily's arms pumped with the relentless consistency of an industrial piston. When they finally got a pulse back, the room collectively exhaled a ragged breath. Harrison wiped sweat from his forehead, immediately puffing his chest out as the patient's terrified daughter was ushered into the room by a social worker. "Your father had a cardiac event," Harrison told the weeping woman, his voice dripping with practiced, heroic bedside manner. "It was close, but I managed to shock his heart back into a normal rhythm. I stabilized him." Emily quietly stepped back into the shadows of the room, her forearms burning, her scrub top plastered to her back with sweat. She silently gathered the discarded plastic wrappings and syringe caps, making the room presentable. She didn't seek the daughter's eye. She didn't wait for a thank you. As she walked out into the hallway to dispose of the biohazard bags, she absent-mindedly rolled up her sleeve to wash her hands at the sink. For a split second, under the harsh fluorescent light, a jagged, horrific cluster of scar tissue was visible wrapping around her right bicep. Shrapnel scars, deep and vicious, stark against her pale skin. She quickly pulled her sleeve down, hiding the only physical evidence of a past she had buried completely. She was just Emily Stanton, the invisible night nurse. She didn't want glory. She just wanted the shift to end. The quiet rhythm of the ICU was violently shattered at 3:30 a.m. The red emergency phone at the main desk, a relic from the 90s that only rang for mass casualty events or incoming high-profile traumas, began to scream. Chloe jumped out of her chair, spilling her cold coffee across the counter. Dr. Harrison, who had been dozing in the break room, hurried out, looking disheveled and irritated. "Who is calling the red line?" Harrison snapped. "Answer it, Davis." Chloe picked up the heavy receiver, her hand shaking. "St. Jude ICU. Yeah. What? Wait. Repeat that." She went pale, her eyes widening to the size of saucers. She slowly lowered the phone. "Dr. Harrison, The ER is sending up a patient right now, bypassing standard intake. Bypassing intake? That's against protocol, Harrison fumed. Who authorized that? The hospital director, sir, Chloe whispered. Richard Sterling. He's in the elevator with them. It's a major trauma. A multi-vehicle accident on the interstate, but they said it was a tactical extraction. Tactical extraction? Harrison scoffed. What is this? A Tom Clancy novel? Prepare bed 1. I want a full trauma panel ready. Before anyone could move, the heavy double doors of the ICU were shoved open. But it wasn't paramedics pushing the gurney. It was 4 men in dark, blood-splattered tactical gear, heavily armed with assault rifles slung across their chests. The hospital security guards trailing behind them looked utterly terrified and entirely useless. Hospital Director Richard Sterling, a man who usually never set foot in the hospital past 5 p.m., was jogging alongside them in his pajamas, his face flushed with panic. "Move! Move! Clear the lane!" one of the tactical operators roared, shoving a heavy medical cart out of the way with brutal force. On the gurney lay a man in his late 40s, his chest a mess of lacerations, bruises, and temporary combat dressings. An endotracheal tube was already shoved down his throat, and a massive puddle of dark blood was pooling on the pristine white sheets. Dr. Harrison stepped forward, trying to assert his authority. "I am Dr. Harrison, the attending. You cannot bring weapons into my ICU." A man who looked like he chewed gravel for breakfast, wearing a tactical vest over civilian clothes, stepped into Harrison's personal space. His eyes were dead and cold. "This is Major David Miller. He is a priority asset. You will fix him, or I will personally throw you out that 7th-story window and find someone who can. Do you understand, Doctor?" Harrison swallowed hard, his bravado instantly evaporating. "Yes, bring him to bed 1. On my count, transfer. 1, 2, 3. The transfer was messy. Blood sprayed across the floor. The monitor was quickly hooked up, and the alarms immediately began screaming. Major Miller's blood pressure was tanking at an alarming rate, 60 over 40, and dropping. "He's bleeding out internally," Harrison yelled, panic creeping into his voice. The tactical operators formed a tight perimeter around the bed, watching Harrison's every move like hawks. The pressure was unimaginable. Harrison's hands shook as he grabbed an ultrasound probe, smearing gel across the patient's ruined chest. Massive hemothorax. "We need to drop a chest tube now. Davies, get me a 36 French tube and prep for a central line." Chloe was paralyzed, staring at the armed men and the blood. Emily materialized beside the bed. She already had the chest tube tray opened, the betadine poured, and the scalpel ready. She didn't look at the tactical operators. She completely ignored the weapons. Her eyes were locked exclusively on the patient's anatomy. Patient's heart rate is spiking to 160. Pressure is 50 over 30, Emily stated calmly. "Doctor, you have the scalpel." Harrison snatched the scalpel, his hand trembling so violently he almost dropped it. He made a clumsy incision between the ribs. Blood rushed out, pooling onto his designer shoes. He fumbled with the heavy plastic tube, trying to force it into the pleural space. But he was hitting the rib. He was panicking. "Push it in!" one of the tactical men yelled, stepping closer. "Back off!" Harrison shrieked, losing his nerve entirely. "I can't get it past the intercostal muscle. His pressure is dropping too fast. Give him a paralytic. I need to secure the central line in his neck before he codes. Push 100 milligrams of succinylcholine, now!" Emily's hand shot out, wrapping around Harrison's wrist with a grip like a steel vice. The doctor gasped in shock, trying to yank his arm back, but she didn't budge. "What the hell are you doing, Stanton?" Harrison screamed. "Release my arm!" "You cannot give him succinylcholine," Emily said, her voice eerily calm, cutting through the chaos of the room. "I gave you a direct order. I am the attending physician. He is going into shock." "Look at his neck, Dr. Harrison," Emily said, her eyes narrowing into cold, hard slits. She pointed with her free hand to the thick, silver dog tags tangled in the blood-soaked mess of the major's chest hair. "Look at the red medical alert tag. tucked behind the primary tag. He has a known severe pseudocholinesterase deficiency. If you push that paralytic, his diaphragm will freeze permanently, and with his current hypovolemic state, you will kill him in under 3 minutes." Harrison froze, his eyes darting to the tiny, blood-smeared tag. He hadn't seen it. He hadn't even looked. "Furthermore," Emily continued, releasing his wrist and grabbing the chest tube from his trembling hand, "you are hitting the rib because your angle is wrong. You are trying to insert it horizontally. This is trauma, doctor, not a textbook." With a swift, brutal, and incredibly precise motion, Emily used her finger to sweep the tract, angled the heavy plastic tube upwards, and slid it smoothly into the patient's chest cavity. A massive rush of dark, trapped blood flowed through the tubing into the collection canister. The monitor instantly chimed as the pressure in the major's chest was relieved. His blood pressure began to slowly tick upwards. "Pressure is stabilizing. 85/50, Emily reported, grabbing the central line kit. "He needs blood, not a paralytic. O-negative, massive transfusion protocol." Harrison stood there, totally emasculated, humiliated in front of the hospital director and the heavily armed men. His face turned violently purple. "You insolent, insubordinate!" he sputtered, spit flying from his lips. "You are fired! Do you hear me, Stanton? You are done! Security, get this nurse out of my trauma bay immediately!" The hospital security guards, who had been hiding near the doors, took a tentative step forward. "Nobody touches her!" A deep, gravelly voice echoed from the doorway. Everyone turned. Standing at the entrance to the ICU, pushing past the hospital director, were 2 United States Marines in full dress blues, their medals gleaming under the harsh hospital lights. They had bypassed the police perimeter outside entirely. The lead Marine, a captain with a face carved from granite, stepped into the room. His eyes swept over the blood, over the trembling Dr. Harrison, and finally locked onto Emily Stanton. He didn't look at her like she was a nurse. He looked at her like he recognized a ghost. The captain ignored the doctor completely. He squared his shoulders, planted his boots, and snapped a textbook, razor-sharp salute, directly at the quiet woman holding the bloody medical instruments. "Staff Sergeant, ma'am," the captain barked, the absolute authority in his voice freezing the blood in Dr. Harrison's veins. "The commanding officer sends his regards. We are here to secure your perimeter." The silence in Trauma Bay 1 was absolute, broken only by the rhythmic, synthetic hiss of the mechanical ventilator pumping oxygen into Major David Miller's battered lungs. Dr. Gregory Harrison's mouth opened and closed like a fish suffocating on dry land. The veins in his neck bulged against his pristine collar. He looked from the towering Marine captain, whose salute remained rigid and unwavering, to Emily Stanton, the quiet, mousy nurse he had spent the last 2 years tormenting. Emily didn't smile. She didn't gloat. Slowly she wiped the major's blood from her gloved hands with a sterile towel, her face a mask of stone. Finally she returned the salute with a crisp, fluid motion that spoke of years of ingrained muscle memory. "At ease, Captain," Emily said. Her voice, usually kept to a hushed murmur to avoid drawing Harrison's ire, now resonated with an undeniable, steely authority. Captain Thomas Hayes dropped his hand, his eyes softening just a fraction as he looked at her. "It's been a long time, Staff Sergeant. The boys at Camp Lejeune thought you fell off the map after the dust settled in Al-Anbar. When Command tracked the Major's medevac to St. Jude S, they pulled the staff roster. General Bradley specifically requested you hold the perimeter here. Hospital Director Richard Sterling, clutching his pajama top tightly around his chest, finally found his voice. "Captain, what is the meaning of this?" "Nurse Stanton is a civilian employee of this hospital." "With all due respect, sir," Captain Hayes replied, not taking his eyes off Emily. "Emily Stanton is a former Joint Special Operations Command combat medic. She ran a forward surgical resuscitation team during Operation Inherent Resolve. She has pulled more bullets out of American heroes in the dark than your entire surgical staff has seen in their lifetimes. If she says this man doesn't get a paralytic, he doesn't get a paralytic." A collective gasp echoed from the doorway, where a small crowd of night shift nurses and respiratory therapists had gathered, drawn by the commotion. Chloe Davies covered her mouth with both hands, staring at Emily as if she were looking at a superhero who had just taken off her glasses. "Doctor." Harrison's face cycled from purple to a splotchy, sickly pale. His authority had been completely dismantled in front of his peers, his subordinates, and his boss. The humiliation burned through his veins like acid. His narcissistic ego, unable to process the profound public defeat, immediately metastasized into venomous rage. "This is an outrage!" Harrison bellowed, his voice cracking slightly. He pointed a trembling finger at Emily. "I don't care what she did in the desert 10 years ago. This is my hospital. This is my ICU." She countermanded a direct medical order from an attending physician, physically assaulted me, and performed a surgical intervention without authorization. "Sterling, I want her badge stripped right now, or I'm calling the medical board and having her license permanently revoked." Director Sterling wrung his hands, caught between the wrath of his highest billing night shift doctor and heavily armed federal operatives. "Greg, please lower your voice. The patient is stabilized." "I don't care," Harrison spit. "She is a liability, a rogue nurse playing cowboy. Fire her, Richard, now." Before Sterling could stammer out a reply, one of the tactical operators, the one who had threatened to throw Harrison out the window, stepped squarely in front of the doctor. The sheer size of the man blocked out the harsh fluorescent lights. "Doctor," the operator growled, his voice low and vibrating with menace, "Major Miller is a Tier 1 asset. He is currently carrying classified intelligence in his head that is vital to national security. If Staff Sergeant Stanton had not bypassed your catastrophic incompetence, he would be dead, and I would currently be breaking your jaw. You are relieved of duty regarding this patient." "You can't do that!" Harrison shrieked, looking wildly at Sterling for support. "Sterling, tell them!" "Actually, Dr. Harrison," a new, sharply dressed man said, stepping into the trauma bay from the hallway. He flashed a federal badge attached to a leather lanyard. "As of 3 minutes ago, the Department of Defense has federalized this specific ward under the National Security Act. We are bringing in our own trauma surgeons from Walter Reed, but they are 2 hours out. Until then, Staff Sergeant Stanton is the only medical personnel permitted within a 10-foot radius of the Major." Harrison was hyperventilating. His world was unraveling. He looked at Emily, expecting to see a smirk of triumph, but she was already turning her back on him, checking the chest tube drainage and titrating the norepinephrine drip to keep the Major's blood pressure climbing. She was ignoring him entirely, treating him like an irrelevant obstacle she had already bypassed. That dismissal hurt Harrison more than a physical blow. "Fine," Harrison seethed, his voice dropping to a toxic hiss. He adjusted his designer coat, his eyes darting around the room, committing every face to memory. "Have it your way, but the rest of this floor is still mine. And Stanton, the second these soldiers leave, the second you step out of this federalized bubble, I will destroy you. I will bury you so deep in malpractice paperwork, you'll never touch a stethoscope again." He turned on his heel and stormed out of the trauma bay, shoving violently past Chloe and the other nurses, retreating to his office to plot his revenge. The seeds for a brutal, career-ending retaliation were sown. The next 48 hours at St. Jude's was suffocating. The hospital had split into 2 distinct warring territories. Bed 1 and Bed 2 were cordoned off by federal agents in suits and Marines in tactical gear, serving as Emily's impenetrable fortress. The rest of the ICU remained under the tyrannical rule of Dr. Gregory Harrison. True to his word, Harrison unleashed a campaign of absolute terror on the floor, specifically targeting anyone who had witnessed his humiliation. He screamed at Chloe for taking 30 seconds too long to fetch a blanket. He wrote up 2 respiratory therapists for minor charting errors. But his primary target, remained the invisible nurse who had broken him. Emily worked her grueling 12-hour shifts without complaint. When she wasn't tending to Major Miller, who remained in a medically induced coma, she was managing her regular patient load. Harrison knew he couldn't touch her while she was with the military personnel, so he waited for her to step out of the perimeter. At 4 a.m. on a Friday, Harrison saw his opening. Emily was assigned to Bed 8, an elderly woman named Mrs. Higgins, who was suffering from acute congestive heart failure. Mrs. Higgins' lungs were filling with fluid, making her breathing labored and shallow. The standard protocol was to administer a strong diuretic, like furosemide, to clear the fluid, carefully monitoring the patient's blood pressure so it didn't crash. Harrison sat at the central nurse's station, his eyes locked on his computer screen. He pulled up Mrs. Higgins' digital chart. His fingers hovered over the keyboard. He knew that Mrs. Higgins had a severe, documented allergy to a specific class of sulfur-based medications. It was buried in her admission notes from a previous hospital stay 3 years ago, a detail easily missed in a rushed emergency setting. With a cold, calculating smile, Harrison typed in a new order. Instead of standard furosemide, he prescribed torsemide, a powerful loop diuretic, heavily reliant on a sulfur chemical structure, and deliberately entered the dosage at the absolute maximum limit. He then bypassed the pharmacy verification alert, overriding it with his attending physician credentials. He printed the order, stamped his signature on it, and walked over to Chloe, who was trembling at her desk. "Davies," Harrison snapped. "Take this physical order to Stanton. Tell her it's a stat push for Bed 8. Mrs. Higgins is drowning in her own fluids. I want that medication in her IV in exactly 3 minutes, or I will write you both up for gross negligence." Chloe nodded frantically, grabbing the slip of paper and sprinting toward Bed 8. Harrison leaned back against the counter, crossing his arms. "Let's see the great combat medic. Catch this," he thought maliciously. "If she pushes that drug, the old woman goes into anaphylactic shock. Her airway closes. Her weakened heart stops. I'll declare a code, fail to resuscitate her, and blame the entire thing on Stanton for failing to check the allergy chart before administering a lethal dose. She'll be fired, disgraced, and facing a manslaughter charge before the sun comes up." At Bed 8, Emily was adjusting Mrs. Higgins' oxygen mask when a breathless Chloe thrust the paper into her hand. "Emily, Dr. Harrison said this is stat. You have to push it right now," Chloe panicked. Emily took the paper. Her cold blue eyes scanned the ink. Torsemide, 100 milligrams IV push. She didn't run to the medication room. She didn't flinch. Instead, she slowly walked out of the room, approaching the central nurse's station where Harrison was watching her like a hawk, waiting for a mouse to trigger a trap. Emily stopped directly across the counter from him. She placed the piece of paper flat on the desk, sliding it back toward him. "I am refusing this order, Dr. Harrison," Emily said, her voice carrying clearly across the quiet ICU. Harrison's eyes lit up with predatory glee. He stood up, puffing his chest out, ensuring the other staff members were watching. "You are refusing a life-saving medical order, Stanton. Is that what you're doing? Are you practicing medicine without a license again? Administer the drug or pack your bags." "Mrs. Higgins has a documented Grade 4 anaphylactic allergy to sulfonamides, Doctor," Emily stated, her voice as calm as a frozen lake. "Torsemide is a sulfur derivative. Pushing 100 milligrams of it into her system would cause immediate laryngeal edema and cardiovascular collapse. You prescribed her a lethal injection." Harrison scoffed loudly, waving his hand dismissively. "Nonsense. That allergy profile is outdated and likely a mild skin rash. You are questioning my medical judgment based on a technicality. I am the doctor. You are the nurse. Push the drug." "No," Emily said simply. "Then you are fired," Harrison screamed, slamming his fist on the desk. "Get out of my hospital. Security!" 2 hospital security guards jogged over, looking nervous. Harrison pointed a shaking finger at Emily. "Escort this woman off the premises immediately. She is terminated for insubordination and endangering a patient's life." Before the guards could take a step toward Emily, a heavy, polished mahogany cane slammed down onto the linoleum floor with the sharp crack of a gunshot. "I don't think they'll be doing that, Doctor." "Harrison," a deep, resonant voice echoed through the ward. Walking slowly down the hallway, flanked by Captain Hayes and Director Sterling, was an older man in a sharply tailored military uniform. The silver stars of a lieutenant general gleamed on his shoulders. But it wasn't the stars that made the blood drain entirely from Harrison's face. It was the man's identity. This was Lieutenant General Arthur Vance. No, wait. General Arthur Bradley, the Surgeon General of the United States Army. He was a legend in the medical community, a man whose medical textbooks Harrison had studied in med school. General Bradley stepped up to the nurse's station, his piercing grey eyes locking on to Dr. Harrison. The general reached into his jacket pocket, pulling out a thick, official-looking folder. "Dr. Gregory Harrison," General Bradley said, his voice quiet, but carrying the weight of an avalanche. "For the last 48 hours, while you were throwing temper tantrums, my team has been conducting a full audit of your department, and we have been watching your digital footprint very closely." Harrison swallowed heavily, taking a step back. "General, I assure you, this nurse is out of control." "Quiet," Bradley commanded, shutting Harrison down instantly. "5 minutes ago, my cybersecurity team flagged a direct override in the pharmacy system. We watched you deliberately bypass an extreme allergy warning to prescribe a lethal dose of medication to an elderly patient, explicitly to frame Staff Sergeant Stanton. You used a patient's life as a pawn in your pathetic ego trip." Harrison's knees buckled slightly. "That's a misunderstanding. I missed the alert. You overrode it using your personal passcode," General Bradley countered, tossing the folder onto the desk. The top document was a printed log of Harrison's exact keystrokes. "That is not a misunderstanding, Doctor. That is attempted murder." The silence in the ICU was deafening. Chloe Davies gasped, stepping away from the desk. The security guards who had just ordered to escort Emily out now turned their attention strictly to Dr. Harrison. General Bradley turned his gaze to Emily. His stern expression melted into one of profound respect. "Staff Sergeant Stanton, your service record in Helmand remains one of the most exemplary files I have ever read. You earned the Silver Star for holding a collapsed bunker together with nothing but gauze and sheer willpower. And tonight, you saved another life by refusing to break under the pressure of a tyrant." The general looked back at the trembling, ruined doctor. "Dr. Harrison, your medical license is effectively suspended pending a federal criminal investigation. Director Sterling has already signed your termination papers. I suggest you call a very good lawyer." The hard karma had finally arrived, and it hit with the force of a freight train. Dr. Harrison, the arrogant king of the night shift, was escorted out of his own ICU in handcuffs, weeping silently as the elevator doors closed on his career forever. The silence that settled over St. Jude's intensive care unit following Dr. Gregory Harrison's dramatic, handcuffed departure was not a peaceful one. It was the heavy, breathless anticipation of a powder keg waiting for a spark. The federal agents had established a rigid, invisible line down the center of the ward. On one side lay the regular civilian patients, their steady heartbeats charting a familiar rhythm. On the other side, behind a curtain of tactical gear and heavily armed Marines, lay Bed 1. Major David Miller had been hovering in the liminal space between life and death for 72 hours. His body was a patchwork of surgical staples, dark purple bruising, and transparent IV lines delivering a continuous, life-saving cocktail of broad-spectrum antibiotics, fentanyl, and vasopressors. Emily Stanton remained at his bedside. She had barely slept, subsisting on bitter black coffee and sheer, ingrained discipline. Her shift had technically ended 12 hours ago, but General Arthur Bradley had made it explicitly clear, until the Major's breathing tube was successfully removed and his cognitive function assessed, Staff Sergeant Stanton was the only medical authority authorized to touch him, At 0200 hours, the telltale signs of emergence began. Miller's heart rate, previously a steady 65 beats per minute, began to climb, spiking to 110. The thick, corrugated tubing of the mechanical ventilator jerked as he initiated a spontaneous breath, fighting the rhythm of the machine. His hands, though strapped to the bed rails with soft restraints to prevent him from pulling his central lines, balled into tight, white-knuckled fists. "He's waking up," Emily announced softly, her voice carrying easily to Captain Thomas Hayes, who stood like a statue at the foot of the bed. "His sedation holiday is complete. He's bucking the vent. I need to extubate him before he causes tracheal trauma." General Bradley stepped out from the shadows of the monitoring alcove, accompanied by a man in an unassuming, tailored grey suit, a handler from the Defense Intelligence Agency, whose name was officially unlisted. "Is he lucid, Staff Sergeant?" the DIA handler asked, his tone clipped and impatient. "We need to debrief him immediately. The people who hit his convoy on I-95 are still at large." "He has a piece of plastic shoved past his vocal cords and down his windpipe, sir," Emily replied, her eyes never leaving the monitor. "He is currently suffocating while waking from a medically induced coma. Lucidity is a secondary concern. Survival is the primary. Step back." The handler bristled, opening his mouth to argue, but a sharp look from General Bradley silenced him instantly. Emily moved with practiced, mechanical efficiency. She unfastened the securing tape around the Major's mouth. "Major Miller," she spoke loudly and clearly, leaning close to his ear. "My name is Emily. You are in a hospital. You are safe. I am going to pull this tube out of your throat. I need you to cough hard on my count. Do you understand?" Miller's eyelids fluttered, revealing eyes that were entirely bloodshot and dilated. For a terrifying second, there was no comprehension in them, only the raw, feral panic of a trapped soldier. He thrashed violently, the bed frames groaning under his sudden, explosive strength. "Hold him down!" the DIA handler barked, reaching for Miller's shoulder. It was a catastrophic mistake. Even heavily sedated and strapped down, Miller's muscle memory was lethal. As the handler's hand touched his skin, Miller's right arm snapped the soft restraint with a sickening rip of fabric. In a blur of motion, his hand shot up, his fingers locking around the handler's throat with a crushing grip. The heart monitor began to scream, alarms blaring red across the bay. The handler gasped, his face turning an immediate, mottled purple as his airway was crushed. The Marines in the room instantly raised their rifles, the mechanical clacking of safeties clicking off, echoing over the alarms. "Stand down! Do not shoot!" General Bradley roared, holding his hands up. Captain Hayes lunged forward to break the grip, but Emily beat him to it. She didn't grab Miller's arm. She didn't yell. Instead, she leaned directly into his line of sight, her face inches from his, completely ignoring the chaotic violence unfolding beside her. "Alpha 6, this is Medivac Actual. Stand down." "You are secure," Emily ordered, her voice cutting through the noise with a sharp, undeniable military cadence. It was the exact tone she had used in the blood-soaked sands of Fallujah. It was a voice that commanded obedience at a cellular level. "Drop the hostile, Major. That is a direct order. Drop him now, him." Miller's wild, terrified eyes snapped to Emily. He stared at her, chest heaving. Slowly, the primitive, combat-induced fog began to clear. He recognized the posture. He recognized the cold, unyielding authority of a combat medic who had just pulled him from the brink. His grip loosened. The handler collapsed against the wall, gagging and clutching his bruised throat. "Count to 3, Major. Cough," Emily commanded softly, smoothly grasping the endotracheal tube. 1, 2, 3. Miller coughed weakly, a wet, rattling sound, and Emily pulled the long plastic tube free in one fluid, unbroken motion. She immediately slapped a high-flow oxygen mask over his face, suctioning his airway to clear the excess fluids. For a long minute, the only sound was the deep, ragged wheezing of Miller's abused lungs pulling in unassisted air. He blinked heavily, looking around the bright hospital room, his gaze finally resting on Emily. "Stanton," he rasped, his voice sounding like two pieces of sandpaper grinding together. His vocal cords were severely bruised. "Is that you?" "It's me, sir," Emily said, securing the straps of the oxygen mask behind his head. "You took a nasty hit to the chest. We had to crack you open and drain the pleural space. You're at St. Jude Medical Center in Chicago." Miller squeezed his eyes shut, a grimace of pain twisting his features. He weakly raised his hand, pulling the mask down slightly. He looked past Emily, directly at the coughing DIA handler and General Bradley. "The extraction was compromised," Miller whispered, his voice barely audible over the hum of the medical equipment. "The convoy. They knew our route. They used armor-piercing incendiary rounds. It wasn't a cartel hit. It was a surgical strike." "We know, David," General Bradley said, stepping closer to the bed. "We are working on identifying the leak. You were carrying the encrypted hard drive from the black site in Berlin. Did they get it?" Miller shook his head slowly, groaning as the movement pulled at his chest incisions. "No. I initiated the thermal destruction protocol before the vehicle flipped. The drive is slag. The data is gone." The DIA handler cursed violently under his breath. "Damn it. Months of deep cover operational intel burned. We have nothing." "Not nothing," Miller croaked, his eyes locking onto Emily with a sudden, desperate intensity. He reached out, his trembling fingers gripping her blue scrub top. He pulled her down closer. "Major, your blood pressure is destabilizing. You need to rest," Emily warned, checking the monitor. "Listen to me," Miller hissed, his breath hot against her ear. He completely ignored the high-ranking officials in the room. He was speaking solely to the medic. "The drive is gone. But I decrypted the primary manifest before we were hit. I memorized the primary target. The mole inside the Department of Defense." General Bradley's eyes widened. "David, tell me the name." Miller coughed violently, a speck of blood appearing on his lips. He looked at the general, then at the handler. Paranoia, deeply justified by the ambush, clouded his features. I don't know who to trust. The leak came from the top. The extraction team was sold out." "You can trust me, soldier," Bradley urged softly. "I trust the medic," Miller whispered stubbornly. He looked back at Emily. "Code word. Archangel. The financial accounts funneling weapons to the terror cells. They are registered under a shell company, Apex Logistics. The CEO is... His monitor shrieked a sudden, piercing warning. His heart rate skyrocketed to 180, and his body arched rigidly off the mattress. "He's going into VTAC!" Emily shouted, slamming her fist onto the emergency call button on the wall. "His potassium levels are crashing from the diuretic push. Push 2 milligrams of Ativan, and get the crash cart back in here, now!" Chaos erupted once again. The fragile peace was shattered as Emily fought to stabilize the very man who held the key to an international conspiracy, knowing that the people who wanted him dead were likely watching the hospital doors. The code blue in bed 1 was successfully reversed, but the exhaustion radiating from Emily Stanton was palpable. It was 0430 hours on Saturday morning. Major Miller slept under a heavy dose of antiarrhythmic medication, the secret name of the traitor locked away in his battered mind until he woke again. General Arthur Bradley and the DIA handler, Cole Hastings, had retreated to a secured conference room to run the name Apex Logistics through classified servers. Captain Thomas Hayes and his Marines remained anchored around the ICU. Emily, mandated to take a brief rest, sat in a dimly lit supply closet, inventorying saline flushes. Outside, Nurse Chloe Davies struggled to keep her eyes open at the central desk. Then the heavy security doors hissed open. Emily paused. Standard hospital staff swiped RFID badges, which produced a sharp beep. This door had simply opened, the electronic lock seamlessly bypassed. Peering through the cracked closet door, Emily watched 4 men in St. Jude maintenance uniforms push a large stainless steel laundry cart down the corridor. They looked ordinary, But Emily's eyes, trained in chaotic war zones, immediately locked onto the lethal inconsistencies. First, their footwear. Standard maintenance wore slip-resistant clogs. These men wore heavy-duty matte black tactical boots designed for silent breaching. Second, they didn't slouch. They moved with synchronized military precision, sweeping the corners for structural cover. Third, the heavy-duty casters on the laundry cart were groaning under a weight that dirty linens simply could not produce. There was something incredibly heavy hidden beneath those sheets. They were the cleanup crew. The lead operative approached the central desk, pulling his clipboard up to obscure his face. He smiled at a bleary-eyed Chloe. "Night shift engineering. We got a call about a busted manifold in the oxygen supply room near the restricted wing. Need to shut the main valve off to patch it. If they shut off the main oxygen valve, Miller's ventilator would fail, drawing the Marines out of position. Once the perimeter broke, the men would pull suppressed weapons from the cart and slaughter everyone." Emily had seconds to act. She stepped out of the closet and walked briskly down the hallway, intersecting the group just as they pushed the cart towards the restricted wing. "Excuse me," Emily's authoritative voice rang out. The four men stopped instantly. "You are not going to the oxygen supply room. Life support gas manifolds cannot be serviced without a 48-hour advance notice signed by the attending physician." The lead operative slipped his hand into his coveralls. "It's an emergency leak, sweetheart. Step aside." "There is no leak," Emily replied, blocking their path. "Furthermore, St. Jude contracts life safety maintenance to Apex Diagnostics. Their uniforms are grey, not navy blue." The operative's smile vanished. The air grew frigid. He pulled a suppressed, matte black pistol and pointed it directly at Emily's chest. "Step aside!" Chloe looked up, saw the gun, and let out a hysterical scream. The operative pulled the trigger, but Emily was already moving. Anticipating the shot, she dropped her center of gravity. The bullet shattered the glass window behind her. She lunged forward, grabbing a heavy, cast-iron IV pole, and swung it with brutal force directly at the operative's kneecap. The metal connected with a sickening crack. The man screamed, his leg buckling. His next shot went wide into the ceiling. "Contact front! Armed hostiles!" Emily roared with the practiced volume of a battlefield commander. Captain Hayes and 3 Marines rounded the corner instantly, M4 carbines raised. "Drop your weapons!" Hayes barked. Panic set in. The assassins realized their stealth mission was now a catastrophic firefight against fully armored Marines. The hard karma they had delivered to others was reflecting back on them. One desperate assassin lunged across the nurse's station, grabbing Chloe by the hair and pressing a pistol to her temple. "Hold fire or the girl dies!" he screamed. The Marines froze, unable to risk Chloe's life. Captain Hayes kept his weapon trained on the man's eye. Crouched behind the overturned laundry cart, Emily caught Hayes' eye. She pointed 2 fingers at her own eyes, then pointed sharply at the red emergency lighting shutoff lever on the wall directly behind the hostage-taker. Hayes gave a microscopic nod. Emily grabbed a heavy metal bedpan. With a sudden grunt, she hurled it, not at the assassin, but at the glass wall of the medication room to his left. The metal smashed through the glass with a deafening crash. The assassin flinched, instinctively turning his head towards the sound. In that exact millisecond, Captain Hayes fired one suppressed round. It wasn't aimed at the man. It shattered the plastic casing of the emergency lever, slamming it downward. Instantly, the ICU plunged into pitch-black darkness. But Captain Hayes and his Marines were wearing advanced, quad-tube night vision goggles. Before the assassin could comprehend the darkness, 2 suppressed shots echoed through the hallway. The heavy thud of a body hitting the linoleum followed. 10 seconds later, the backup generators kicked in, flooding the ward with dim red light. The assassin lay motionless. Chloe was weeping, but unharmed. The other operatives had surrendered. Captain Hayes lowered his rifle and walked over to Emily, who was already dusting off her scrubs to check Chloe's vitals. He shook his head in awe. "The boys back at command used to say you were the most dangerous medic in the sandbox. I'm starting to think they underestimated you." Emily adjusted her bun, completely calm. "The hospital is a battlefield, Captain. Now, if you'll excuse me, Mrs. Higgins is late for her beta blockers." The flashing red and blue lights of federal vehicles painted the exterior of St. Jude Medical Center in a chaotic strobe. Inside the intensive care unit, the aftermath of the foiled assassination was handled with chilling military efficiency. The surviving hitmen had been zip-tied and dragged into unmarked transports. Yet, amid the swirling storm of FBI agents, Staff Sergeant Emily Stanton was exactly where she always was, at the bedside of her patients, having just administered Mrs. Higgins' delayed medication. But the night was not over. The deepest rot had yet to be excised. Down the hall, in the secured perimeter of Bed 1, Major David Miller was fighting his way back to consciousness. General Arthur Bradley stood at the foot of his bed, his face etched with grim determination. Next to him stood Cole Hastings, the impeccably dressed DIA handler. Hastings was sweating profusely, his eyes darting toward the heavy doors, checking his gold Rolex. "The hit squad failed, Cole," General Bradley rumbled. "Staff Sergeant Stanton and Captain Hayes neutralized them. The second the Major can speak clearly, we have the name of the traitor running Apex Logistics." Hastings swallowed hard, offering a tight smile. "We can't wait, General. The mole will initiate a burn protocol. I brought a specialized neurostimulant from the agency. It will temporarily bypass his sedation and give him 5 minutes of absolute clarity. I'm administering it now." He pulled out a sleek, silver auto-injector. "Stop right there," a cold voice commanded. Emily stepped into the room. Something about Hastings had been gnawing at her finely tuned instincts. "Nurse Stanton, you are dismissed," Hastings snapped. "I am the lead medical authority here, Agent Hastings," Emily replied, her eyes locked on the silver device. "And I know what that is. It's a Type 4 BZ derivative auto-injector. It doesn't provide clarity. It induces a massive, localized cerebral hemorrhage. It's a Black Ops assassination tool." General Bradley froze. "Cole, what is she talking about?" Hastings' face drained of color. The ultimate twist had caught him in its jaws. He was the CEO of Apex Logistics. He was the mole who sold out Miller's convoy, using the federal hospital takeover as his golden ticket to finish the job personally. Realizing his cover was blown by a night shift nurse, Hastings panicked. The hard karma for his treason was staring him in the face. He lunged toward Miller's IV line, his thumb jamming down on the release trigger. Emily was faster. The combat medic closed the distance in an explosive stride, grabbing Hastings' wrist and twisting it violently. The crack of his wrist snapping echoed through the sterile room. Hastings screamed, dropping the injector. He threw a desperate punch, but Emily slipped inside his guard, driving her palm upward into his nose. Blood sprayed across his pristine shirt. Captain Hayes burst through the curtain, tackling the bleeding handler to the ground and pinning his arms. "Archangel," a raspy voice croaked. Major Miller had pulled his oxygen mask down. His eyes were wide open, locked on the pinned DIA handler. "The shell company, Apex Logistics," Miller wheezed, pointing a trembling finger. "It's him, Cole Hastings. He's the CEO. He sold us out." Disgust radiated from General Bradley as he stared at the writhing man. "Agent Hastings, you are under arrest for high treason and terrorism. You will disappear into a black site so deep the sun will become a myth to you." Hayes hauled the broken traitor to his feet, marching him out. The karma of a lifetime of deception had finally crushed him. General Bradley turned to Emily, who was calmly bagging the silver injector. He removed his starred cap, a rare gesture of absolute respect. "Staff Sergeant Stanton, I want you back in uniform. I will personally fast-track you to a major's commission." Emily looked at the general, then at Major Miller's stabilizing monitor. She thought of Chloe and Mrs. Higgins. "With respect, General," Emily said softly, a tired smile touching her lips. "I spent 10 years pulling bullets out of soldiers. I don't want to command battalions. I just want to be a nurse." Bradley studied her immovable resolve. "Very well. But know this. Dr. Harrison is in a federal holding cell, his medical license destroyed. You will never be invisible again. Anyone who gives you a cross look will answer to the United States Marine Corps." Emily Stanton simply nodded, turning back to her patient, a silent guardian in faded blue scrubs keeping watch over the night. What an absolutely incredible true story of a silent hero in plain sight. Emily Stanton proved that the most dangerous, brilliant, and capable people in the room are often the ones who speak the least. Arrogance and ego always invite hard karma, and Dr. Harrison and the traitorous DIA agent learned the hard way that you should never underestimate the quiet professional who refuses to break under pressure. True heroism isn't about titles, designer coats, or shouting the loudest. It's about stepping up and doing what's right when the absolute worst chaos strikes. If this dramatic, twist-filled story of military justice and hospital heroics had you on the edge of your seat, please hit that like button right now. Share this incredible story with anyone who loves seeing the underdog deliver an epic dose of karma, and make sure to subscribe to the channel and ring the notification bell so you never miss our next real-life storytelling masterpiece.